Victoria's Health Department says more staff will be working at the state's COVID testing centres today to reduce waiting times. Reporter Oliver Gordon has more from Melbourne.
There were 1,999 new COVID-19 cases and 3 further deaths, and there are 368 people in Victorian hospitals with COVID-19. Of people in Victorian hospitals with COVID-19, 80 are in ICU and 38 are on a ventilator. And there were 57,818 tests conducted yesterday, and there are 16,467 active cases across the state today. If we look back at the last few days of new cases and hospitalisations, on Christmas Eve, 2,095 new cases, 397 people in hospital. On Christmas Day, 2,108 new cases, 361 in hospital. On Boxing Day, 1,608 new cases reported, 374 in hospital. And then today, 1,999 new cases with 368 people in Victorian hospitals. So you can see we are steady around that 2,000 new case mark, and hospitalisations around just under 400, pretty steady from before Christmas. Long lines are continuing across the state today. 16 testing facilities are already listed as temporarily closed due to capacity, and there are reports of people waiting up to 5 days to receive their negative PCR test, which is of course an inconvenience if people are heading interstate and they need to get a negative PCR test within 3 days. The health department say they're putting extra staff on today to deal with this demand, which could also be coming from people who've been gathering over the Christmas period, going around to lots of different places around the state. We've also seen messages sent to people who've been at exposure sites like pubs, instructing them to get a rapid antigen test if they're symptomless for COVID-19 and struggling to get a PCR test. This is, of course, a change from a time when if you were at an exposure site, you had to get a PCR test. So a signal there that the Victorian government may be willing to use rapid antigen tests in place of PCRs in some instances.